Today I will be the Diffessor, and we're going to be doing a crash course on the male anatomy. If this landed on the wrong For You page because you already know it all, please send it to someone who doesn't. Up here we have the dingle part, and down here we have the dangle part. And yes, those are clinical terms. No, not really. Here is going to be the shaft of the penis, which ends in the one-eyed monster, which is called the glans. This whole structure here, yours is not detachable, is actually a homologue with the female clitoris. That is why it is so important not to leave this out, because I assume they don't leave yours out. A not so fun fact about the impregnation stick is that it can be broken when erect, even though it contains no bone, and that is because there is a spongy tissue in here that becomes engorged with blood. But around all of that tissue is something that is sort of like an aponeurosis or a ligamentous sheath that keeps everything tightly bound. And if you bend it too much, you can actually tear that sheet and give yourself a nice audible and very painful pop. That would be a broken penis, and it is a medical emergency. I know some of you are already in the comments asking about length and does it matter? Well, let's talk about averages, because average is about 5.5 inches, which is a little under 14 centimeters, or if you want American units, it'd be 1/64th of an eagle's wing. And because I know my audience, if you're gonna run off and measure this is the proper technique. You don't get to measure from the bottom. There's too much room for error there. You're gonna wanna get fully flagpoled, and then you're gonna take your measuring device and push the zero end of it into the top of your pubis. Not too hard. We don't need any impalements just to get a few extra centimeters here. Then you're gonna wanna look where your manwich ends and the corresponding number on the top. That is how long you are. If you've never thought to ask, yes, there is a medically verified world record holder for this. It is going to be 14.5 inches with 8.5 inches of girth. You are talking about a forearm's worth of penis. And remember how I was telling you that it's spongy tissue that has to be engorged with blood? Well, legend has it, it takes him about 35 minutes to get fully bricked up. If you can't get a pelvic stifler, know that this is one of the early symptoms of something being wrong with your cardiovascular system, either your heart or your peripheral vasculature. So it is time to talk to a doctor about that. All right, it is time to talk about population paste, sperm and semen. First thing you need to know is that they are made in two different locations. Sperm are made by a pair of structures that reside inside of your man purse, your scrotote, your scrotum. Scrotum is just Latin for the word bag or purse. Actually, right down the middle of your scrotum, if you've never noticed, you will actually see a zipper-like seam, and that is where your former labia, yeah, those labia, were actually zippered shut from that time you almost became a girl. And if you're one of those people who's going to tell me we all start female in the womb, that is incorrect. We actually start undifferentiated, and we have foundational tissues that take different paths based on the hormones that they are exposed to. Remember how I told you that the penis and the clitoris are the same structure? Well, if you took someone who owns and operates a clitoris and gave them testosterone, it will begin to grow at any age. Okay, where were we? Sperm. They are made in the testicle, and then they are sent to this structure on the side. This is called the epididymis. You can think of this like elementary, middle, and high school. It's where they go to mature, and this process actually takes about 72 days. That means that sperm you're seeing during an ejaculation is actually around 3 months old. Sperm are little divas, and they require a very specific temperature to be made and to mature. That is part of the reason that your testicles hang on the outside of you. What you may not know is that there is actually a muscle that wraps each testicle individually. It is called the cremaster. Yes, seriously. And its whole job is that if you are too cold, it will actually pull them up into your pelvis a bit, and if you're too hot, it will actually let them dangle a little more. Now this is where things get sticky. We're going to talk about ejaculation and where semen is made, because when it is time for the money shot, the finishing move, the sperm are going to be moved up through this tube here called the vas deferens with a teeny tiny amount of fluid, and they are going to go around here to the back of the bladder. Once those little tadpoles have arrived at the back of the bladder, they will be mixed with semen, which is made partially by the seminal vesicles on the back of the bladder, and this right here, which is a glandular muscular tissue called the prostate. Now that we know where semen is made, let's bust a myth about vasectomy, because there are more than a few men out there that believe that the incision that is done way down here in the vas deferens, or the ductus deferens, actually stops your ejaculation, or turns it into dust, or makes it to where you're going to have a permanent case of blue balls. None of that is true. Because here's the thing, sperm only make up about 2 to 5% of the visible fluid that you see when you pop your tent at Camp Release. So when they cut this tube, it does not mean that you're losing your ejaculation. You're just losing the sperm. It's all the juice, none of the pulp. Now, what happens to the sperm that is left behind here? Well, the same thing that always happens. They just get broken down, recycled, internally swallowed. There's something you won't forget. All right, before you go, we got to talk about pre-cum, pre-ejaculate, and for that, we're going to have to visit a tiny pair of glands called the bulbourethral glands. These sit below the prostate before the urethra exiting the body, and they make an alkaline fluid that actually neutralizes all of the acidic urine that's kind of hanging out in the shaft of your penis. And the reason for this is that sperm do not like acid, and so if you didn't neutralize it, it would actually kill some of these and possibly cause some fertility issues. Okay, hats off to you. You are committed to learning because you're watching a long video. So let's squeeze in a few more fun facts and then I'll let you go. Circumcision is medically unnecessary. It is mostly cosmetic, and it would be akin to removing the clitoral hood, because the clitoral hood and the male foreskin are the same thing. And gee, these next two spots sure are anatomically interesting because they are sites of incredible nerve innervation, meaning there are lots of nerve bundles here. The first one is going to be a spot called the frenulum. If you have a foreskin here, you may actually notice something that looks a little bit like a banjo string or a guitar string. If you don't, you will just see this ridge here. This is just interesting because it is loaded with nerve endings. And last but surely not least is going to be the prostate gland itself. Now, during medical exams, this is actually palpated to check for cancer and other abnormalities through the rectum. You would put your fingers in, and then you would push anteriorly to feel a little bit like when you do a testicle exam. From the outside, though, it can actually be accessed between the space behind the testicles and before the anus. I believe this is called the gooch, or maybe it taint. Thank you for watching this crash course on the male reproductive system. If you've got a question, leave it in the comments. And like I said, if you know someone who needs this information, please send it to them.